Hello everyone, and welcome back to a Vital Nursing 101 video. Today we are going to talk about aspirin. Aspirin is one of those medications that nursing students hear about all the time. It is available over the counter, it can be used for pain, fever, inflammation, and it is also used in lower doses to help prevent blood clots in certain patients. But aspirin is not a simple medication just because it is common. Aspirin can increase the risk of bleeding. It can irritate the stomach, it can cause serious allergic reactions. It can contribute to salicylate toxicity, and it should generally be avoided in children and teenagers with viral illnesses because of the risk of Reye syndrome. So today, we are going to break aspirin down step by step in a way that is beginner-friendly for nursing students. We will talk about what aspirin is used for, how it works, how it is different from other NSAIDs, important side effects, major warnings, nursing responsibilities, lab monitoring, patient teaching, and what findings should be reported to the provider. And throughout the video, I will include pop test questions to help you think like a nurse. Let's start with the basics. Aspirin is also called acetylsalicylic acid. You may see it abbreviated as ASA. That is important because in the clinical setting, a provider may say, the patient takes daily ASA, and they mean aspirin. Aspirin belongs to a medication class called NSAIDs. NSAIDs stands for non-steroidal anti-inflammatory drugs. That means aspirin can help reduce pain, fever, and inflammation. But aspirin has something special that makes it stand out from many other NSAIDs. Aspirin has an antiplatelet effect. Antiplatelet means it helps prevent platelets from clumping together. Platelets are blood cells that help form clots. So aspirin can reduce pain and fever at some doses, but at lower doses, it is often used to reduce the risk of clot formation in certain patients. A simple memory tip is, aspirin affects aches and aggregation. Aches means pain. Aggregation means platelets clumping together. So aspirin helps with aches, but it also affects platelet aggregation. Pop test question. What does ASA stand for in medication language? A. Acetylsalicylic acid. B. Advanced steroid agent. C. Anti-seizure antibiotic. D. Acute sugar activator. The correct answer is A. ASA stands for acetylsalicylic acid, which is aspirin. Now let's talk about why aspirin is used. Aspirin may be used for pain, fever, and inflammation. For example, a patient may take aspirin for a headache, muscle aches, arthritis discomfort, or fever, depending on provider recommendations and patient safety factors. But in nursing school and clinical practice, aspirin is also very important because of its antiplatelet effect. Low-dose aspirin may be used for certain patients who have a history of cardiovascular disease, such as a previous heart attack, previous stroke, certain types of heart disease, or after certain cardiac procedures. You may hear the phrase baby aspirin, which usually refers to low-dose aspirin, often 81 milligrams. But do not let the phrase baby aspirin confuse you. It does not mean it is for babies. In fact, aspirin is usually avoided in children and teenagers with viral illnesses because of Reye syndrome risk. So it is better to say low-dose aspirin rather than baby aspirin when teaching patients. Aspirin is also commonly discussed in emergency cardiac care. For example, a patient having symptoms of a possible heart attack may receive aspirin if it is not contraindicated because aspirin can help reduce platelet clumping and clot formation. But patients should follow emergency instructions and provider guidance. They should not delay calling emergency services. Pop test question. Aspirin is unique among many NSAIDs because it has what important effect? A. Antiplatelet effect. B. Antibiotic effect. C. Insulin effect. D. Antifungal effect. The correct answer is A. Aspirin has an antiplatelet effect, meaning it reduces platelet clumping. Now let's talk about how aspirin works. Aspirin works by blocking enzymes called COX enzymes. COX stands for cyclooxygenase. COX enzymes help make prostaglandins and thromboxane. Prostaglandins are chemical messengers involved in pain, fever, and inflammation. Thromboxane helps platelets clump together to form clots. So when aspirin blocks COX enzymes, it reduces prostaglandins and thromboxane. Less prostaglandin means less pain, less fever, and less inflammation. Less thromboxane means less platelet clumping. Here's the key difference. Aspirin irreversibly inhibits platelets. Irreversible means the platelet cannot just recover and start working normally again. The body has to make new platelets. Platelets live for about 7 to 10 days. That is why aspirin's antiplatelet effect can last for days, even though the medication itself does not stay in the body forever. This is very testable. If a patient is scheduled for surgery, the provider may tell them to stop aspirin several days before the procedure, depending on the reason they take aspirin and the bleeding risk. Patients should not stop aspirin on their own, especially if they take it for heart or stroke prevention. They should follow provider instructions. Memory tip: aspirin affects platelets for their lifetime. The platelet is affected until the body replaces it. Pop test question: why can aspirin increase bleeding risk for several days? A. It permanently destroys all red blood cells. B. It irreversibly affects platelet function until new platelets are made. C. It turns into heparin. D. It blocks insulin. The correct answer is B. Aspirin irreversibly inhibits platelet function, so bleeding risk can last until new platelets are produced. Now let's compare aspirin with other pain medications. Acetaminophen, also known as Tylenol, helps with pain and fever, but it does not have strong anti-inflammatory effects and does not have the same antiplatelet effect. NSAIDs like ibuprofen and naproxen help with pain, fever, and inflammation. But aspirin is especially known for its antiplatelet effect. Opioids like morphine, hydromorphone, oxycodone, and tramadol treat moderate to severe pain, but can cause respiratory depression, sedation, constipation, dependence, and overdose risk. Aspirin is not an opioid. Aspirin is not acetaminophen. Aspirin is an NSAID with antiplatelet effects. That is the big picture. Aspirin may be used for pain and fever, but when you see low-dose aspirin on a medication list, think cardiovascular protection and platelet inhibition. Pop test question: a patient says, aspirin and Tylenol are the same thing, right? What is the best response? A. Yes, they are the exact same medication. B. No, aspirin is an NSAID with antiplatelet effects, while acetaminophen is not. C. Yes, both are opioids. D. No, aspirin is an antibiotic. The correct answer is B. Aspirin and acetaminophen are different medications with different safety concerns. Now let's talk about common side effects. Common aspirin side effects often involve the stomach. Patients may experience upset stomach, heartburn, nausea, or abdominal discomfort. Aspirin can irritate the stomach lining. It can also increase the risk of ulcers and gastrointestinal bleeding. This risk is higher in certain patients. Examples include older adults, patients with a history of stomach ulcers or GI bleeding, patients taking anticoagulants or blood thinners, patients taking steroids like prednisone, patients taking other NSAIDs like ibuprofen or naproxen, and patients who drink alcohol regularly. Signs of stomach bleeding include black tarry stools, bright red blood in the stool, vomiting blood, vomit that looks like coffee grounds, severe stomach pain, weakness, dizziness, fainting, or low blood pressure. Coffee ground emesis means vomit that looks like dark coffee grounds. That can be a sign of old blood in the stomach. Memory tip: aspirin can make the stomach and blood unhappy. Stomach irritation and bleeding are major concerns. Pop test question: a patient taking aspirin reports black tarry stools. What should the nurse do? A. Document it as expected and give another dose. B. Report it because it may indicate GI bleeding. C. Tell the patient to take aspirin with soda. D. Ignore it if the patient has no pain. The correct answer is B. Black tarry stools may indicate gastrointestinal bleeding and should be reported. Now let's talk more about bleeding risk. Aspirin reduces platelet aggregation. That means bleeding may take longer to stop. Patients may bruise more easily. They may have nosebleeds. They may notice bleeding gums when brushing teeth. They may bleed longer from cuts. In some patients, bleeding may be internal and harder to see. That is why nurses monitor for signs like fatigue, weakness, dizziness, low blood pressure, increased heart rate, blood in urine, blood in stool, or a drop in hemoglobin and hematocrit. Aspirin can be especially risky when combined with other medications that increase bleeding risk. Examples include warfarin, heparin, enoxaparin, apixaban, rivaroxaban, dabigatran, clopidogrel, other NSAIDs, corticosteroids, and some antidepressants like SSRIs or SNRIs. This does not mean these combinations never happen. Sometimes providers intentionally use antiplatelet and anticoagulant therapy together for specific conditions, but it does mean the nurse should monitor carefully and clarify concerns when needed. Pop test question. Which medication combination increases bleeding concern? A. Aspirin plus warfarin. B. Aspirin plus water. C. Aspirin plus a balanced meal. D. Aspirin plus a blanket. The correct answer is A. Aspirin and warfarin both increase bleeding risk, so the patient needs careful monitoring. Now let's talk about allergic reactions and aspirin-sensitive asthma. Some patients are allergic or sensitive to aspirin. Signs of allergic reaction include hives, rash, swelling of the face or throat, wheezing, trouble breathing, or severe itching. Some patients have aspirin-exacerbated respiratory disease. This means aspirin or other NSAIDs can trigger respiratory symptoms like bronchospasm, wheezing, or shortness of breath. This is especially important in patients with asthma or nasal polyps. Before giving aspirin, ask about previous reactions to aspirin or NSAIDs. If a patient says, ibuprofen makes me wheeze, or aspirin made my throat swell, that is important. Do not ignore it. Pop test question. A patient says, last time I took aspirin, I started wheezing and my lips swelled. What should the nurse do? A. Give aspirin anyway. B. Hold the medication and report the possible allergy or sensitivity. C. Tell the patient to take 2 tablets. D. Document it as a normal side effect. The correct answer is B. Wheezing and lip swelling may indicate a serious reaction and should be reported. Now let's talk about Reyes syndrome. This is a major aspirin teaching point. Reyes syndrome is a rare but serious condition that can affect the brain and liver. It has been linked with aspirin use in children and teenagers, especially during viral illnesses like influenza or chickenpox. Because of this risk, aspirin is generally avoided in children and teenagers unless specifically directed by a healthcare provider. This is why nurses teach parents not to give aspirin to children or teens for fever or viral symptoms unless a provider specifically tells them to. Also, teach families to check labels. Some over-the-counter products may contain aspirin or salicylates. The word salicylate is related to aspirin-like compounds. Patients and caregivers should read labels carefully. Memory tip: aspirin in adolescents with viruses are a warning. Pop test question. Why should aspirin usually be avoided in children and teenagers with viral illnesses? A. Risk of Reyes syndrome. B. Risk of diabetes. C. Risk of improved appetite. D. Risk of stronger bones. The correct answer is A. Aspirin used during viral illnesses in children and teenagers is linked to Reyes syndrome, a serious condition affecting the brain and liver. Now let's talk about salicylate toxicity. Aspirin is a salicylate. Too much aspirin can lead to salicylate toxicity, also called aspirin toxicity. This can happen from taking too much at one time or from taking too much over time. Early symptoms may include ringing in the ears, also called tinnitus, hearing changes, dizziness, nausea, vomiting, sweating, and headache. Tinnitus is a classic test question. If a patient taking aspirin says, "My ears are ringing," think salicylate toxicity. More serious symptoms can include confusion, agitation, fever, fast breathing, rapid heart rate, dehydration, acid-base imbalance, seizures, coma, and even death. Fast breathing can happen because salicylates affect the respiratory center and acid-base balance. If salicylate toxicity is suspected, this is urgent. The provider may order a salicylate blood level, electrolytes, blood gas, kidney function tests, glucose, and other labs. Treatment depends on severity and may include activated charcoal in some acute situations, IV fluids, sodium bicarbonate, and in severe cases, dialysis. As a nurse, your job is to recognize symptoms early, hold further doses if appropriate according to safety protocols, notify the provider, and monitor closely. Memory tip: ringing ears means aspirin fears. Pop test question. Which symptom is a classic warning sign of salicylate toxicity? A. Ringing in the ears. B. Increased height. C. Blue hair. D. Improved night vision. The correct answer is A. Tinnitus, or ringing in the ears, can be an early sign of aspirin toxicity. Now let's discuss major warnings and black box warnings. Aspirin products commonly carry strong warnings about stomach bleeding. The risk is higher in people who are age 60 or older, have a history of stomach ulcers or bleeding problems, take blood thinners or steroids, take other NSAIDs, drink 3 or more alcoholic drinks daily, or take more than directed. Aspirin can also increase bleeding risk because of its antiplatelet effect. Patients should tell their healthcare provider before surgery, dental procedures, or invasive procedures if they are taking aspirin. Aspirin should not be used in children or teenagers for viral symptoms unless directed by a provider because of Reye syndrome risk. Aspirin can cause allergic reactions, including severe reactions in patients sensitive to aspirin or NSAIDs. Aspirin should be used cautiously in patients with asthma, history of GI bleeding, kidney disease, liver disease, bleeding disorders, uncontrolled hypertension, or those taking anticoagulants. Aspirin is not automatically safe just because it is over the counter. That is one of the biggest teaching points. Now let's talk about nursing responsibilities before giving aspirin. First, assess the reason for the medication. Is it ordered for pain, fever, inflammation, antiplatelet therapy, possible chest pain, or acute coronary syndrome? The reason matters because the dose and nursing priorities may be different. Second, check allergies. Ask about aspirin allergy, NSAID allergy, asthma reactions, wheezing, hives, swelling, or previous severe reactions. Third, review bleeding risk. Ask about history of GI bleeding, stomach ulcers, bleeding disorders, easy bruising, nosebleeds, blood in stool, or blood in urine. Fourth, review the medication list. Look for anticoagulants, antiplatelets, NSAIDs, steroids, SSRIs, SNRIs, herbal supplements like ginkgo or garlic at high doses, and alcohol use. Fifth, assess vital signs. Blood pressure, heart rate, and signs of bleeding are important. Sixth, assess pain or fever if aspirin is being used for those reasons. Seventh, assess for surgery or procedures. If the patient is scheduled for surgery, dental work, spinal procedures, or invasive procedures, aspirin use may need to be reviewed. Eighth, check age and viral illness history in children or teenagers. Do not give aspirin to a child or teenager with viral symptoms unless specifically ordered and appropriate. Ninth, review labs when available. Important labs may include platelet count, hemoglobin, hematocrit, renal function, liver function, and coagulation studies depending on the patient. Pop test question. Before giving aspirin, which assessment is most important? A. Allergy history, bleeding risk, medication interactions, and reason for use. B. Favorite color. C. Shoe size. D. Hair length. The correct answer is A. Aspirin requires assessment for allergy, bleeding risk, interactions, and indication. Now, let's talk about lab monitoring. There is no routine aspirin level for every patient taking low-dose aspirin. But monitoring depends on why the patient takes aspirin and their risk factors. For bleeding risk, monitor hemoglobin and hematocrit. A drop in hemoglobin and hematocrit may suggest bleeding. Monitor platelet count. Aspirin affects platelet function, not necessarily the platelet number, but the platelet count still helps assess overall bleeding risk. If the patient is on warfarin, monitor INR. INR does not measure aspirin effect, but it matters because warfarin increases bleeding risk too. Monitor kidney function with BUN, creatinine, and eGFR, especially in patients taking higher aspirin doses, older adults, or patients with kidney disease. Monitor liver function if liver disease is present, or if the provider is concerned. If salicylate toxicity is suspected, monitor salicylate levels, electrolytes, blood gas, glucose, kidney function, and acid-base status depending on provider orders. For patients taking aspirin for heart-related conditions, you may also monitor symptoms, ECG, troponin, and vital signs depending on the clinical situation. But remember, Aspirin's antiplatelet effect is not usually measured by a routine bedside lab in everyday nursing practice. You monitor the patient clinically for bleeding and complications. Pop test question. Which lab trend may suggest bleeding in a patient taking aspirin? A. Decreasing hemoglobin and hematocrit. B. Increasing hair length. C. Normal appetite. D. Increased shoe size. The correct answer is A. A drop in hemoglobin and hematocrit may indicate blood loss. Now let's discuss administration tips. Aspirin can come in different forms. There are immediate release tablets, chewable tablets, enteric-coated tablets, buffered tablets, and suppositories. Chewable aspirin is often used in emergency cardiac situations because it can be absorbed faster than enteric-coated aspirin. Enteric-coated aspirin is designed to dissolve later in the intestines, which may reduce stomach irritation for some patients, but it does not eliminate bleeding risk. This is important. Enteric-coated does not mean no stomach bleeding risk. Patients may think coated aspirin is completely safe for the stomach, but aspirin still affects platelets and can still increase GI bleeding risk. Aspirin should usually be taken with a full glass of water. Taking it with food may reduce stomach upset, but again, food does not remove bleeding risk. Do not crush or chew enteric-coated tablets unless the provider specifically directs it. Do not crush extended-release products unless allowed by the product instructions. If aspirin is being given for suspected heart attack symptoms, follow facility protocol and provider orders. Pop test question. Does enteric-coated aspirin completely eliminate the risk of GI bleeding? A. Yes. B. No. C. Only if taken with soda. D. Only if taken at night. The correct answer is B. Enteric-coated aspirin may reduce stomach irritation for some patients, but it does not eliminate bleeding risk. Now let's talk about patient teaching. Teach patients why they are taking aspirin. If it is for pain or fever, they should follow the label or provider instructions and not exceed the recommended dose. If it is for heart or stroke prevention, they should take it exactly as prescribed and not stop without talking to the provider. This is very important. Some patients stop aspirin before procedures without asking. Other patients keep taking it when they were told to hold it. Both can be risky depending on the patient. Teach patients to report signs of bleeding. This includes black stools, bloody stools, vomiting blood, coffee ground vomit, unusual bruising, bleeding gums, nosebleeds, blood in urine, heavy menstrual bleeding, weakness, dizziness, or fainting. Teach patients to avoid taking multiple NSAIDs unless the provider says it is okay. For example, do not take aspirin, ibuprofen, and naproxen together without medical guidance. Teach patients to avoid heavy alcohol use because alcohol increases the risk of stomach bleeding. Teach patients to tell all healthcare providers, including dentists, that they take aspirin. Teach them to check medication labels. Some products contain aspirin or salicylates. Teach parents and caregivers not to give aspirin to children or teenagers with viral illnesses unless specifically directed by a provider. Teach patients to report ringing in the ears, hearing changes, confusion, fast breathing, severe nausea, or vomiting, because those may be signs of salicylate toxicity. Teach patients to report allergic symptoms like rash, hives, wheezing, swelling, or difficulty breathing. Pop test question. Which patient statement shows correct teaching? A. I should tell my dentist that I take daily aspirin. B. Enteric-coated aspirin has no bleeding risk. C. It is safe to give aspirin to children with the flu. D. Ringing in my ears is never important. The correct answer is A. Patients should tell healthcare providers and dentists that they take aspirin because of bleeding risk. Now let's talk about what findings should be reported to the provider. Report signs of GI bleeding. This includes black tarry stools, bright red blood in stool, vomiting blood, coffee ground emesis, severe stomach pain, weakness, dizziness, fainting, low blood pressure, or rapid heart rate. Report signs of unusual bleeding. This includes easy bruising, bleeding gums, nosebleeds that are hard to stop, blood in urine, or heavy bleeding from cuts. Report allergic reactions. This includes hives, rash, swelling of the face, lips, tongue, or throat, wheezing, or trouble breathing. Report signs of salicylate toxicity. This includes ringing in the ears, hearing changes, confusion, sweating, fever, fast breathing, rapid heart rate, nausea, vomiting, seizures, or altered mental status. Report if a child or teenager has taken aspirin during a viral illness. Report if the patient is taking aspirin with anticoagulants, other antiplatelets, steroids, or other NSAIDs, and develops bleeding symptoms. Report if the patient has upcoming surgery or procedures, and the aspirin plan is unclear. Report uncontrolled pain or fever. Report chest pain or stroke symptoms immediately according to emergency protocols. Aspirin may be part of emergency treatment, but it does not replace urgent care. Pop test question. A patient taking aspirin reports ringing in the ears, nausea, and fast breathing. What should the nurse suspect? A. Possible salicylate toxicity. B. Normal expected finding. C. Improved platelet function. D. Low blood sugar only. The correct answer is A. Tinnitus, nausea, and fast breathing can be warning signs of salicylate toxicity. Now let's walk through a clinical scenario. You are caring for Mr. Johnson, a 68-year-old patient who takes low-dose aspirin daily because he had a heart attack in the past. He is admitted for weakness and dizziness. During your assessment, he says his stools have been black for the past 2 days. His blood pressure is lower than usual and his heart rate is elevated. What should you think? You should think possible GI bleeding. Aspirin increases bleeding risk, and black tarry stools may indicate upper GI bleeding. The nurse should assess vital signs, ask about other medications like anticoagulants or NSAIDs, check labs such as hemoglobin and hematocrit if available, and notify the provider promptly. Do not dismiss black stools as normal. Let's do another scenario. A parent says, "My 12-year-old has the flu, and I gave aspirin for the fever." What should you teach? You should explain that aspirin is generally avoided in children and teenagers with viral illnesses because of the risk of Reye syndrome. The parent should contact the child's healthcare provider for guidance. Teach them to read medication labels carefully because some products may contain aspirin or salicylates. Here is another scenario. A patient comes to the emergency department with chest pressure, sweating, and shortness of breath. They say, "I took aspirin at home because I thought it might be my heart." What should the nurse do? The nurse should treat this as a possible cardiac emergency and follow emergency protocols. Aspirin may be appropriate in suspected heart attack if there are no contraindications, but the priority is rapid assessment, emergency care, ECG, vital signs, provider evaluation, and appropriate treatment. Patients should be taught not to delay emergency care by trying to manage chest pain at home. Now let's review the nursing school must-know points. Aspirin is acetyl salicylic acid, also called ASA. Aspirin is an NSAID. It can reduce pain, fever, and inflammation. Aspirin also has antiplatelet effects. It irreversibly inhibits platelet function, so bleeding risk can last for days until new platelets are made. Aspirin can cause stomach irritation, ulcers, and GI bleeding. Aspirin can increase bleeding risk, especially with anticoagulants, antiplatelets, steroids, other NSAIDs, alcohol, and older age. Aspirin can cause allergic reactions and can worsen breathing in some aspirin-sensitive patients. Aspirin should generally be avoided in children and teenagers with viral illnesses because of Reye syndrome risk. Too much aspirin can cause salicylate toxicity. Classic symptoms of salicylate toxicity include ringing in the ears, hearing changes, nausea, vomiting, sweating, fast breathing, confusion, fever, seizures, and altered mental status. Important nursing assessments include reason for use, allergy history, bleeding risk, medication interactions, pain or fever, vital signs, surgery or procedure plans, age, and viral illness in children or teens. Important labs may include hemoglobin, hematocrit, platelet count, kidney function, liver function, INR if on warfarin, and salicylate level if toxicity is suspected. Patient teaching includes taking aspirin exactly as directed, not stopping prescribed aspirin without provider guidance, avoiding multiple NSAIDs unless approved, limiting alcohol, reporting bleeding, telling providers and dentists about aspirin use, avoiding aspirin in children with viral illness unless directed, and reporting signs of toxicity. Memory tip: aspirin helps aches and platelets, but watch bleeding, belly, breathing, and ringing. Bleeding from antiplatelet effect. Belly from GI irritation. Breathing from allergic or asthma-type reactions. Ringing from salicylate toxicity. Now let's finish with 5 true or false review questions. Question 1. True or false? Aspirin is also called acetyl salicylic acid, or ASA. The correct answer is true. Rationale: ASA stands for acetyl salicylic acid, which is aspirin. Question 2. True or false? Aspirin has antiplatelet effects and can increase bleeding risk. The correct answer is true. Rationale: aspirin decreases platelet aggregation, which can help prevent clots in certain patients, but also increases bleeding risk. Question 3. True or false? Enteric-coated aspirin completely prevents GI bleeding. The correct answer is false. Rationale: enteric-coated aspirin may reduce stomach irritation for some patients, but it does not eliminate the risk of ulcers or GI bleeding. Question 4. True or false? Aspirin is generally avoided in children and teenagers with viral illnesses because of Reye syndrome risk. The correct answer is true. Rationale: aspirin use in children and teenagers with viral illnesses, such as flu or chickenpox, has been linked to Reye syndrome, a serious condition affecting the brain and liver. Question 5. True or false? Ringing in the ears can be a warning sign of salicylate toxicity. The correct answer is true. Rationale: tinnitus or ringing in the ears is a classic symptom of salicylate toxicity and should be reported. And that is your beginner-friendly nursing pharmacology review of aspirin. Remember, aspirin is common, but it is not harmless. It can help with pain, fever, inflammation, and platelet prevention, depending on the dose and reason it is ordered. But nurses must watch for bleeding, GI irritation, allergic reactions, Reye syndrome risk in children and teenagers, and salicylate toxicity. Always think, why is the patient taking it? Are they bleeding? Are they taking other blood thinners? Do they have stomach problems? Are they a child with a viral illness? Are their ears ringing? As a nurse, your job is to assess carefully, give safely, teach clearly, and report concerning findings early. Thank you for watching, and I'll see you in the next nursing pharmacology lesson.